Hello everyone. Today we are discussing about intravenous agents. Intravenous agents in anesthesia practice. First is thiopentone. It is mostly commonly used to barbiturate. Available as a sodium salt and must be dissolved in isotonic sodium chloride or water to prepare solutions of 2.5%. Highly alkaline pH about 9, can be irritating to the tissue if injected extravenously. It does not cause pain on injection. Methoxytone is the only barbiturate causing pain in injection. Induction dose is 3 to 5 mg per kg body weight in adults, 5 to 6 mg per kg body weight in children. Decrease dose by 30% in old age. Dose is calculated according to lean body weight. Central nervous system, decrease in cerebral metabolic oxygen requirement and cerebral blood flow, thereby lowering intracranial pressure. So it is the choice intravenous agent choice in neurological conditions. Improve cerebral perfusion and compliance. In cardiovascular system, decrease systemic arterial pressure, decrease cardiac output, decreases peripheral vascular resistance. In respiratory system, respiratory depression, blunts hypoxic and hypercarbonic drive, can cause laryngospasm or bronchospasm following induction. Hepatic and renal, pre-existing hepatic and renal disease resulted in decreased plasma protein binding of the drug, thus enhancing its CNS and cardiovascular depression properties. No direct toxicity of liver or kidney. Second one is propofol. Propofol is substituted isopropyl phenol, that is the administered intravenously as 1% solution. It is milky white color. Other additives are 10% soybean oil, 2.25% glycerol and 1.2% purified egg phosphatide. Since propofol is an insoluble drug that requires a lipid vehicle for emulsification, these additives are added. This formulation supports bacterial growth and may cause increased plasma triglyceride concentration. Effect on CNS, decreases cerebral metabolic oxygen metabolic requirement, cerebral blood flow as well as intracranial pressure. It is a neuroprotective role. It decreases electroencephalogram activity, EEG activity. It is used as anticonvulsant. It often produces a subjective feeling of well-being on emergence. On CVS, direct myocardial depression, decreases systemic vascular resistance, causes vasodilation and negative inotropic effect. Bradycardia related death, profound bradycardia and asystole after administration of propofol have been described among healthy adult patients. Despite prophylactic anticholinergics, propofol compared to other intravenous anesthetic is more associated with oculocardiac reflex in pediatric patients. On respiratory system, it causes respiratory depression, blunts hypoxic and hypercapnic drive, bronchodilation, maintains hypoxic pulmonary vasoconstriction. On hepatic and renal effects, propofol does not adversely affect hepatic or renal function as reflected by analysis of liver enzymes and creatinine concentration. It has unique property of anti-emetic effects. Clinical aspects of uses: induction of anesthesia, maintenance of anesthesia, sedation, antiemetic, antipyretic. Agent of choice for anesthesia in day care surgery, mostly common asked question. Neurosurgery, thoracic surgery, pre-existing renal and hepatic dysfunction, malignant hypothermia, porphyria, endoscopic procedures. Propofol infusion syndrome. In critically ill children or adults receiving high dose infusion of propofol, some patients have been reported of experience PRIS, which is characterized by cardiac failure, rhabdomyolysis, metabolic acidosis and renal failure. It is associated with a high dose and long-term use of propofol, that is greater than 4 mg per kg per hour for greater than 24 hours. Methoxytone, not used nowadays. Epileptogenic, IV agent choice for ICT to induce convulsion in ECT. Intermediate, most cardiovascular stable. Onset of action, 1 arm brain circulation time 15 to 20 seconds, duration 3 to 5 minutes when given IV. Dosage for induction of anesthesia 0.2 to 0.4 mg per kg IV. IV agent of choice for all cardiac patients and vascular surgeries. Not used because it may lead to adrenal cortex suppression. Intermediate inhibits the activity of 11 beta hydroxylase, an enzyme necessary for synthesis of cortisol, aldosterone, 17 hydroxyl progesterone and corticosteroid. Pain on injection site, high incidence of post-operative nausea and vomiting. Myoclonic activity inhibit platelet function. Ketamine. It is structurally related to phencyclidine, water soluble, transparent, and available 1 to 5% solution. Route of administration IV, IM, oral, rectal, or intranasal produces so-called dissociative effect of anesthesia, so it's called as dissociative anesthesia. Acts to NMDA receptors. Anesthetic agents choice in IV agent in shock patient causes hypertension. IV agents for full stomach patient as it preserves airway reflexes. Bronchial asthma as bronchodilator. Cyanotic heart disease, analgesic, and sedation. Disadvantages. VBD reaction, hallucination 50 to 60% patients, VBD dreaming 30%, emergency delirium 25%. Only treatment is benzodiazepines. It increases all pressures, intraocular, intergastric, and intracranial pressure. Dexmedetomidine, highly selective alpha 2 adrenoreceptor agonist, used mainly IV adjunct during induction or maintenance of general anesthetics. Minimal respiratory and cardiovascular depression, good sedation, good analgesic, sympatholytic effects. Selective for alpha 1 is to alpha 2 receptor is 1640 is to 1. Use of IV anesthetic agents, induction of anesthesia, maintenance of anesthetic, and sedation. Opiates. Classification of opiates. According to action, it can be classified as pure agonist, intrinsic activity 1, for example, morphine, fentanyl, subfentanyl, alfentanyl, and ramifentanyl, etc. Partial agonist, intrinsic activity 0 to 1, for example, buprenorphine. Mixed agonist, antagonist, for example, pentazocine, butorphanol, nalbuphine. Pure antagonistic, intrinsic activity is 0, naloxone, naltrexone. According to the source, it can be classified as naturally occurring morphine, codeine, papaverine, thebine. Semi-synthetic heroin, dihydromorphone, morphinone, thebanine derivatives, etophine, buprenorphine. Synthetic morphine series, levofan, butorphanol, diphenyl propylamine series, levofan, butorphanol, benzomorphan series, pentazocine, phenylpiperidine series, meperidine, fentanyl, subfentanyl, afentanyl, remfentanyl. Side effects. Respiratory depression causes muscle rigidity, uterine chest syndrome in thoracic muscle, maximum with afentanyl. Constipation, opioid bowel syndrome, constriction of sphincter of body. Peripheral antagonistics, methyl naltrexone or albumipan. Antagonize only peripheral effects of opioids, that is constipation, preserving the central effects of opioids, analgesia. TIVA, total intravenous anesthesia. The ability of a drug with short blood-brain equilibrium times enabled with a clinical to use intravenous anesthetics and analgesics where controllability is easy and recovery rapid. Total intravenous anesthesia offers some important advantages over inhalation anesthetics, including rapid recovery with minimal hangover and low incidence of nausea and vomiting. TIVA may be the technique of choice for some operations. The most common combination used for TIVA is propofol and ramifentanyl. It has added advantage in neurosurgery for decreasing intracranial pressure. It has added advantage in thoracic surgery of having drugs which maintain pulmonary vasoconstriction reflexes. It is safely used in patients with malignant hypothermia gene. It decreases the risk of environmental pollution.